conventional and holistic medicine. All right. Do you find that there's a greater need or less need for diagnostic resources to be able to determine where that balance is for a particular patient?
So interesting questions. I think as a society, we've become very imaging dependent.
Uh,
And I think as a result of that, the public in general has come to expect
oh, yeah.
imaging for everything.
I remember.
Now, where we were trained, we were heavily trained in physical examination.
Mm.
It was drilled into us because we were trained under the British system. And you had to be able to pick certain signs up just by examining the patient. And again, because we were in a relatively resource-poor setting for training and for practice, we didn't have the luxury of MRI for everything. And I think even the US healthcare system now is starting to feel the brunt of that reality as well, which is it's expensive to run an imaging test for every single question that you have. So even before going into integrative medicine, I considered myself a clinician, and I believed in the ability to examine the patient and get the information, and using imaging to confirm or give additional scope to the information that I had already gathered from the history and physical exam. So I'm big on taking a good history, and that hasn't changed regardless of the approach I'm using.